Hi, and welcome to Doctor's Daily Dose. Ever leaned in to talk, only to see someone subtly back away? That could be bad breath, as known as halitosis, making things awkward. But don't worry, you're not stuck with it. Let's get to the root of bad breath and learn how to beat it for good, right here on Doctor's Daily Dose. What is halitosis? Halitosis is the medical term for persistent bad breath. It's not just about morning breath. It's the kind of smell that doesn't go away even after brushing. It can be short-term or chronic, and often, it's trying to tell you something important about your health. Causes of bad breath. Broadly speaking, the source of a person's bad breath may come from 4 different regions: the nose, mouth, throat, and lungs. Before being able to successfully treat bad breath or halitosis, one must first determine where the bad breath is coming from. Is it coming from just the nose, just the mouth, or both from the nose and mouth? Assuming air coming out of the lungs is fresh and pure, should bad breath emanate only from the mouth but not the nose? The source of the bad smell is somewhere in the mouth. For example, the morning breath. 90% of bad breath starts in the mouth. Let's break down the top causes. Poor oral hygiene, bacteria on teeth and tongue. It's actually hundreds of types of bacteria that are naturally found in your mouth. Your warm, moist mouth works as a perfect hothouse for bacteria to grow. After you eat, that bacteria goes to work, consuming the food particles left in your mouth and secreting wastes, known as volatile sulfur compounds. It's these compounds, which smell like rotten eggs, that cause bad breath. The longer you wait to remove those food particles by brushing and flossing, the more likely your breath will offend. Most of the bacteria that cause bad breath are found on the back of your tongue and probably form a white or brownish coating. Gum disease, gingivitis, or periodontitis. Persistent bad breath or a bad taste in your mouth can also be a warning sign of advanced gum disease, which is caused by plaque. Dry mouth, from medications or dehydration. Another cause of bad breath is dry mouth. Your saliva works around the clock to wash out your mouth. So, if you don't have enough saliva, your mouth isn't getting cleaned enough. This can be caused by various medications, salivary gland problems, or simply by breathing through your mouth. Smoking or tobacco use. Smoking and chewing tobacco can cause persistent bad breath and increase the risk of gum disease. Strong-smelling foods. Foods like garlic, onions, spices, and coffee can cause temporary bad breath. Crash diets or fasting can cause bad breath due to ketones production. Ill-fitting dental appliances or dirty dentures. If you wear removable dentures, take them out at night and be sure to clean them thoroughly before using them again the next morning. If the bad breath only occurs from the nose but not the mouth, the source of the bad odor is due to some type of sinonasal issue like a sinus infection or nasal foreign body. Less commonly, the bad breath emanates from both the nose and mouth. This suggests the source of the bad smell to be coming from the throat or even the lungs. Examples of lung or throat issues that may cause halitosis include post-nasal drip, tonsil stones, GERD, acid reflux, throat cancer, and lung infections, as well as more systemic issues like diabetes and advanced kidney or liver disease. Symptoms and social impact. You might notice a bad taste, dry mouth, or people offering you gum. Awkward. Halitosis can affect confidence, relationships, job interviews, mental well-being. It's more than just a hygiene issue, it's a quality of life issue. How to prevent and fix bad breath. Let's fix that breath naturally. Oral hygiene. Brush teeth at least twice a day with fluoride toothpaste and floss daily to remove food particles and plaque. Clean your tongue, a major bacteria trap. Brush the tongue to remove bacteria and food debris. You can also use a tongue scraper. Studies have shown that tongue brushing reduces bad breath measurements by 70%. A rinse with antiseptic or saltwater mouthwash. Antibacterial mouthwashes can help reduce bacteria that cause bad breath. Choose mouthwashes specifically designed to treat halitosis. Chew sugar-free gum. It stimulates saliva production and helps cleanse the mouth, reducing the risk of bad breath. Visit the dentist regularly for cleanings and checkups to identify and treat dental issues early. Nutrition tips. Stay hydrated. Drink plenty of water to maintain saliva production and wash away food particles. Dry mouth breeds odor. Avoid foods that cause bad breath. Eat crunchy fruits and veggies like apples, celery. They scrub the teeth. Include parsley, mint, and green tea. They are natural deodorizers. Avoid sugary, sticky foods and acidic drinks. Quit smoking and cut down on alcohol. Stopping smoking can significantly improve breath odor and overall oral health. Home remedies. Chew on fennel seeds or cardamom. Rinse with baking soda plus water. When to see a doctor or dentist. If your bad breath lasts more than 2 weeks even after good hygiene, it's time to see a professional. Visit a dentist for oral exam, gum health, tongue check, or a family physician. If the dentist clears you, but symptoms persist, they may look for sinus infections, throat infections, GERD, diabetes, a liver or kidney disease, medication side effects, any tests or medications. Yes, there are ways to measure halitosis. Halimeter measures sulfur compounds. BANA test detects bacteria enzymes. X-rays or blood tests if systemic disease is suspected. Medications. Chlorhexidine mouthwash, prescription. Artificial saliva for dry mouth. Treatments for underlying causes like reflux or infection. But remember, medicines are not the first step. Good hygiene and identifying the root cause are key. Bad breath may seem minor, but it can signal bigger issues. Start with your brush, check your tongue, clean your plate, and when in doubt, check it out. Stay confident, stay fresh, and stay tuned to Doctor's Daily Dose for more trusted healthcare advice. Thanks for watching.